Hi, friends. This is Dr. Ravi Kamapali. I'm an infectious disease, wound care, and obesity medicine doctor in Georgia. I want to present a case and a patient's perspective on this nice gentleman who had a complicated wound. We don't have much of any conflict of interest for this. This is a case from my office, and most of conflicts involve me being guy who wants to remove barriers to healing for infections, wounds, and obesity. And we're working on a telemedicine solution that empowers the patients to improve their overall health. Quickly to present, this is a nice 63-year-old male who has had history of gunshot injury, and he has had long-term injury with this gunshot, ending up with problems leading up to paraplegia and other issues, including prostate cancer and problems with colostomy and gout, along with his hypertension and chronic kidney disease, for which he's on hemodialysis. Initially presented to our office in July 2022, and he already had this decubitus ulcer, as you can see here. And they did try to do, they did do a flap, in fact, in 2014. And when he presented to the office, his temperature was 101.3 degrees Fahrenheit. He ended up getting admitted to the hospital, and we continued antibiotic therapy. He had other wounds. We'll go through those wounds in a bit, but we'll focus mostly on the right ischial wound. So patient did end up having a wound vac, which is done with the debridement of the ulcer bed, and also wound vac applied. And basically, plastic surgical consultation was also requested, and debridement was done. And initially, he ended up having problems with a small area of bleeding on the skin inside, from the inside, that was also noted. And we found out later that he did end up having a right femur fracture, and that was causing the bleeding. And basically, we ended up figuring that out and had the surgery for the femur fracture, and ended up starting continued wound care, and also started on wound vac therapy. And this is like in 2022. And as we started active local wound care, we started doing placental skin substitute grafts in January 2023, and ended up slowly but steadily working on. And if you see here, his wound is slowly improving, and basically patient did go on to heal, and we ended up avoiding a flap procedure on him. So basically, this involved active local wound care that involved wound debridements, and we ended up starting to do placental skin substitute amniotic allograft. 10 of them were done, and this was done from January 26, 2023. And the ulcer went on to heal. Even though, despite all these complicated clinical problems, he had significant improvement and healing and avoidance of flap. So basically, his problem was also involving other major issues where he has had problems with the left thigh area ulcer also. And this is a dialysis patient with different ulcers. And fortunately for him, he has had paraplegia, so no pain issues when we were taking care of him. And also, he ended up having hip fracture that was fixed. They did show some gram-positive bacteria, and he ended up having a second course of IV antibiotic therapy with IV vancomycin. And also, he had other issues with slow healing. We did biopsy of this area. It showed that it did not have any calciphylaxis, which is normally a debilitating condition in patients with dialysis. But that was not the cause for this problem. But he had significant left thigh area ulcer too that is slow, but has gone on to have healing, but with scar tissue. Also, he did end up having olecranon elbow area bursitis, And he ended up also having issues with pericardial effusion and uh, also had complications with multi-drug resistant gram-negative rod urinary tract infection also, for which he was treated. So all said and done, this is his sternal like a pericardial window that was done in another hospital. But overall, he went on to heal after this complex clinical scenario, and he was gracious enough to give an interview. Please see this.
How are you? Pretty good. How are you? Good, good. So, almost it has been what, a year or more than that since we know each other? Yeah, more than a year. Okay. So, tell me how did we end up meeting and what was your problem?
Well, we first started, I had some kind of growth on my thigh.
Uh-huh.
We started there.
Uh-huh.
And then I got a pressure ulcer on my butt, like, on the right side.
Yeah.
And it was about
that big.
About that big.
Uh-huh.
And we thought we were going to have to put a flap on it.
Uh-huh.
But he got to work on it.
You had a flap before on the left side.
Yeah.
And that you had a flap. And this one, we thought that you might end up needing a flap.
Right.
And then you had we had done a graft, the placental skin substitute grafts. I think we did 10 or 11 of them.
Yeah.
And then
once you start doing that,
and in the meantime also you had a fall and a hip fracture or something like that on the same hip.
You're on the same hip.
Mm-hmm.
They went in to breathe it. Some kind of way. My hip got broken because they say
and you are bleeding through that, and we had some bleeding problem. And so what is the common theme that you found during the time I was taking care of it? What was the common theme? What did you get out of what I was saying or doing?
Well, the common theme was that once you start doing that graft thing,
mm-hmm.
That's when it really started accelerating.
But every time you came, what did I do?
To breathe it.
Yeah,
because you said you didn't want to.
The biofilm, and I was talking about nutrition, biofilm, and wound healing, and offloading. Okay, and debriding the dead tissue off.
Right.
And this is like a ulcer that has gone to your bone, and you, with all your medical problems, what do you have?
I had infection for a long time.
Infection, we treated with IV antibiotics.
Right.
And you had, what other medical problems you have?
Well, they say the reason why my hip probably broke because I had 45 radiation treatments for prostate cancer.
Prostate cancer, radiation, and the wounds that did not heal. But also you are
dialysis. Yeah.
Dialysis. Are you diabetic too?
No, I'm not diabetic.
But and then you ended up now recently also having heart problem with.
I just got out of the hospital because I had they got
fluid around the heart.
Ounces of fluid off my heart and 37 ounces off my lungs.
Yeah.
And I still got a little bit on my right lung.
And you're paralyzed too.
Yeah, I'm paralyzed.
And you have a ostomy, paralyzed, wheelchair bound, and still very, very positive.
Oh yeah.
Yeah, I mean, like, this is one of the positive person I have met. I mean, like, even with all the gunshot, whatever happened, and with everything that happened in your life, what I learned from you is be positive.
Yeah.
Do you have any message for people who go through this problem?
Well, you just said it. Be positive.
Yeah.
Be positive, and it helps to have a good wife.
Nothing beats that.
Yeah.
Okay. Okay. Good. Thank you for taking time, and thank you for trusting us. Okay.
Thank you, Doc.
Okay.
Good job.
Thank you very much.
So in conclusion, this is a gentleman who has had problems with gunshot injury, paraplegia, significant comorbidities, including prostate cancer, radiation therapy, and restricted mobility, and dialysis with problems with hyperuricemia, and also recurrent flap procedures, ending up with dialysis with pericardial window and protein calorie malnutrition. So the message I want to give with this is it's very good to be positive with any clinical condition, but also have care delivery models that are supportive of patients' perspective and try to deliver solutions that are empowering to them. Thank you very much.